But we will start with that discussion about the rising cost of living in the capital, I'm sure, forcing people here to make some very difficult decisions. Families will no doubt be prioritising feeding themselves, heating their homes, rather than taking part in sport or going to their local leisure centre or gym. Meanwhile, those leisure centres, swimming pools, gyms are going to be struggling too, to keep pools heated, for example, to keep lights on. And there is a warning that 40% of council areas are at risk of losing their leisure centres and pools within the next few months unless there is government intervention. Well, that is the message from ukactive. They're a not-for-profit industry association promoting the interests of commercial fitness gyms and community leisure centres. Earlier this afternoon, I spoke to their chief executive, Huw Edwards, not that one, and started by asking him how the cost of living crisis is affecting those organisations that he represents.
Well, it's having a massive impact, Emma. Obviously, the sector is showing incredible resilience coming out of the pandemic, and now we're facing a huge challenge, both from our members' customer base with the cost of living crisis, and that's how it's impacted them, but also from my core membership, which is having a huge challenge with the energy crisis, which is having a significant impact now. So we have been working with government for the last 6 or 7 months, really showcasing the impact of soaring costs and anything up to 250% increase in energy costs for some of my members, especially members who run swimming pools, and what that projection will look like. And the reality now is that we're seeing closures across the country and restrictions of service, which is hugely detrimental to communities across the country and in London as well. And our new figures from last week showed that we're projecting that 40% of council areas would lose facilities or have facilities restricted service by the spring. So there's a real concern that a lot of my members won't make it through the winter, irrespective of the projected support that the government's talking about for vulnerable sectors from the 1st of April.
So it's a double problem in that you have gyms, leisure centres, for example, that can't afford the increased costs of electricity, of heating swimming pools, etc., but also that we, as members of the public going to those places, aren't going as often, can't afford to go to those leisure facilities?
It is a concern, yeah, absolutely. And what you're seeing with my members, they're doing everything they can to try and minimise the pressure on the customer and the consumer, who come from all different backgrounds and all different ages as well, and trying to make as efficiency savings where they can. But ultimately, some of that will be passed on to the customer in very challenging circumstances. But the big concern is that, you know, these facilities are incredibly important for the communities they operate in, and whether that be swimming lessons, whether it be multi-sport facilities like football, whether it be long-term health condition programs for disabled people, programs for female-only, programs for older people. These are at risk of being lost now because of the energy crisis, unless there is a real focus and commitment to try and find a resolution in the most challenging circumstances.
I think I saw a report recently on the BBC. It was a swimming pool that was having to close because of these issues, because of the added cost of keeping it open. And as you say, it's not just about the closing of the swimming pool and the effect it will have on that particular facility, but it's about all the people that go to that swimming pool, that value that time.
Absolutely. These facilities are more than just bricks and mortar. They're within the fabric of their communities, and a huge amount of people. That report talked about with great emotion some of those older people who use those classes every week to support their physical health, but also their social well-being as well. And what you saw was the anxiety that the loss will generate. Now, that's heartbreaking to see, and you know, that is being replicated regrettably across other parts of the country and in London as well. And what we know is that there is an irreconcilable situation between the costs that my members are facing right now, and that is irrespective of the energy price guarantee that the government's brought in, which was important because it avoided catastrophic prices for the moment. But what you are seeing is real pain, and that pain is unfortunately going to lead to restriction of services, restrictions of facilities, and also closures as well. So there's nothing more important than someone's health, you know, whether it's yours, whether it's the family, whether it's the community that we live in. And we've got to find a way to try and keep these facilities working and operating to serve the communities that they operate within.
Is that the message you're sending to the government in order to persuade them to do more to help?
Absolutely. And I think the government's in a very challenging situation. We know there's an autumn statement coming up on the 17th of November. We understand that that's going to be very difficult for all parts of society. We acknowledge and respect that. And we know that every sector is in exactly the same position. We're working hard with the government on something called the Bayes Review, which is looking at that support package for vulnerable sectors from April 1. But the challenge we have now is that these facilities won't make it through to April 1. And this is about the health of communities. This is about the health of Londoners, about the health of our families and friends and our loved ones, from the youngest through to the oldest. And these facilities provide that essential service in communities. And their loss and their pausing of service will have a massive impact on the physical and mental and social well-being of Londoners. So we want to work with government now. We want to understand the strength of their commitment to the sport and physical activity sector and the provision of these services, and try and work with them hand in hand to try and find a solution in the most challenging environment that we face. Again, another challenging environment so quickly after the pandemic.
How easy will it be to kind of get that message across, to persuade the right people to help in these challenging circumstances, do you think? Because I think often we speak on this programme about how important it is for people to be physically active, to take part in sport, as you've mentioned already, not just for their physical health, but for their mental health as well. So you can emphasise that positive impact of taking part in sport, going to a leisure centre, that will be lost. But I do wonder if you are kind of knocking the door to a government that is already got so many other people with their kind of hands outstretched saying we need money too.
It's a really good question, and it's a really big challenge. And all we can do is show government, alongside the case studies that you saw last week in the swimming pool, the reality. And we have shown comprehensive levels of data, quantitative data, the projections that we have, but also of not just the implication of where these facilities, if they weren't around, what that looks like, but also the implications of loss and the pressure that will be put on the operational impact on the NHS in London, on social care services in London, on educational and community services in London, and also a poorer ill health of Londoners, which will have an impact on productivity and an impact on the economy in London as well. Those are the implications of loss. They're all interconnected. That's the reality. And it's a very difficult challenge for the government, but we have to show them that, you know, the fact is that these services are the first mile of healthcare in the city, as they are across the country. They play such an essential service to the communities they operate in, and their absence will have a profound impact on the economic and social and health of London, as well as the whole country as well. So everything is about weighing up on priorities. I think the biggest priority we have ultimately has to be around the health of the people in our families, in our communities, in the nation, because that's the only foundation in which we can build and grow and get out of this crisis that we got out of the pandemic as well.
So where are we now? Are you in fear of swimming pools, leisure centres closing and never opening again? And how long can you wait until you hope to get some kind of positive response from the government, do you think?
Well, conversations with the government are ongoing, and that they are being undertaken in the right spirit. We know there is an autumn statement next week. That won't be the end of the conversation, because there needs to be ultimately, fundamentally, a situation where the government really shows clarity to the communities in which they serve and operate and serve and represent, how they're going to service the potential loss of services and community services within those areas. Regrettably, the projections we gave to government back in the spring are becoming a reality now, with closures and restrictions happening now. Our next projections mean that's forecasting an acceleration of closure through the winter and through the spring. We can't afford that to happen, and so it's about getting around the table with government, with all the right people across central and local government, my members, operators across the country, other key partners as well, to try and look at all options to ensure that local people are able to access facilities that support their physical and mental well-being. The price of not doing that is profound, and will have a long impact for generations to come.
Has the pandemic made the people that you represent, the organisations that you represent, any more robust at all, or has it made them weaker? I just wondered if they learnt from lockdown different ways of working potentially that might help them under these current circumstances.
Yeah, really good question. So there has been learnings. There's been learnings around professional, some professional standards in terms of, especially the focus on hygiene and across that. And you see a completely transformed sector in some areas, in terms of the highest possible standards. You see a much greater embracing of hybrid services and hybrid programs through the digital transformation of my members' services for their customers. But people still like going to that physical space because of the as well as the enjoyment, but also the social connection as well. Parts of the sector, had to use a considerable amount of their own financial assets to survive the pandemic and get through that. And so their ability to flex and absorb pressure now is much more limited than it would have been 3 years ago. And so the biggest exposure is around some of the financial resilience of parts of my members, especially on that sort of public sector leisure side who run swimming pools. And that's where the biggest pressure is being felt around energy prices. So there is a great resilience in the sector. There has been learnings and adaptations of service to make sure that they can support their communities in the best possible way. But we need to see that level of focus and priority given to their needs right now if they are, for the long term, going to be around to support communities in the future.
How are you feeling currently? Are you feeling optimistic or pessimistic? How is your glass half full or half empty?
My glass is half full because I know this is a really important agenda for the country in terms of, and there is my members represent millions of people, and there are millions of stories there which talk about the value of why they go and visit these facilities for whatever reason, for their physical, mental and social well-being. It's my responsibility with my team and with other parts of the sector to make the best possible case and to continue to make that best possible case with government, working alongside government to find a solution, because that's the best way we can work through this, is to find the best possible way together in a shared ambition to try and find the best possible outcome for communities in the most challenging of times.
Well, let's speak to somebody